Hi, I am Dr. Aida Başgül Martin, and I will talk about the basics of diffusion, osmosis, and tonicity. Every health worker's first duty should be do not harm. I believe understanding the effects of the infused solutions with different tonicity will prevent serious complications. Definitions: molecules in our body in constant movement, either by an active or passive movement. The active transport requires energy. Passive transport does not require energy. Diffusion and osmosis are the good example for passive type of transport. Diffusion is the net movement of molecules according to the concentration gradient from a higher concentration area to the lower concentration. Diffusion can occur in gases, in liquids, or through solids. Osmosis is the specific type of diffusion of the water through semi-permeable membrane. The ability of an extracellular solution to make water move into or out of a cell by osmosis is known as its tonicity. Three terms: hypotonic, isotonic, and hypertonic are used to compare the osmolarity of a cell to the osmolarity of the extracellular fluid around it. When we drop an ink droplet in a beaker full of water, the ink will diffuse from higher ink concentration area to the lower ink concentrated area until equilibrium reached. In other words, every part of the water has equal amount of ink. The small molecules and gases such as oxygen and carbon dioxide travels in and out of the cells through diffusion by passing through cell membrane as shown in the picture on the right. Water always moves from an area of higher water potential to an area of lower water potential. In other words, water moves always toward wherever have the higher concentration of solids. Water potential is affected by two factors: osmotic pressure and amount of solid. A solution's tonicity is related to its osmolarity, which is the total concentration of all solids in the solution. A solution with low osmolarity has fewer solid particles per liter of solution, while a solution with high osmolarity has more solid particles per liter of solution. When solutions of different osmolarities are separated by a membrane permeable to water but not the solid, water will move from the side with lower osmolarity to the side with higher osmolarity. Have you thought, why don't red blood cells pop in the bloodstream? Because plasma is isotonic. Inside of the red blood cell and the plasma of the blood have the same tonicity. Iso means same. Although the equal amount of water will diffuse in and out of the cell, however, there will be no net movement of water into or out of the cell. This process shown with two arrows, one toward inside, another outside of the cell. Imagine a red blood cell droplet into distilled water. Water will move into the red blood cell and cause the cell to expand, stretching the flexible cell membrane. At some point, the pressure of the incoming water will cause the cell to pop, just like an overfilled balloon. Distilled water has lower osmolarity than the fluid inside the cell. It's said to be hypotonic. Hypo means less than to the cell. And the net flow of water will be toward into the cell. We can show this with an arrow directed towards inside of the cell. When the red blood cells are ruptured, we will call this hemolysis. It will not only cause anemia, but also increase the plasma potassium level. However, if you place a corn kernel into hypotonic solution, it will get pulpy due to plant cell have cell wall and central vacuole to store the excess water. Animal cell does not have neither cell wall nor large central vacuole. What if the extracellular fluid has a higher osmolarity than the red blood cell's cytoplasm? It is called hypertonic. Hyper means greater than to the cell, and water will move out of the cell to the region of higher solid concentration. We will call this as crenation and show with an arrow direction from cell to outside of the cell. When we transfuse any fluid to the patient, we are changing their inner environment. Intravenous solutions' effect on body fluid movement depends in part of its tonicity or the concentration of solids in solution. Infusion Nurses Society classifies a solution as isotonic if its tonicity falls within 280 and 300 milliosmol per liter. A hypotonic solution has an osmolarity less than 280 and hypertonic solution has an osmolarity greater than 300 milliosmol per liter. Isotonic solutions are given to expand circulating volume and replace actual fluid losses. Commonly used isotonic solutions are shown in this table. When a patient develops diabetic ketoacidosis, the intracellular space becomes dehydrated due to higher solid concentration in plasma due to the sickness. So the administration of a hypotonic solution helps to rehydrate the cells. Again, examples given in this table. When a hypotonic solution is administered, it puts more water in the serum than is found inside the cell. As a result, water moves into the cell, causing them to swell. They should not be infused indefinitely. Hypertonic solutions used to help re-establish equilibrium in electrolyte and acid-base imbalances, include electrolyte replacement solutions and parenteral nutrition solutions. But because hypertonic solutions can cause severe damage to the vein, all fluids with an osmolarity greater than 600 milliosmol per liter, such as solutions containing more than 10% dextrose, should be infused through a central venous access. I hope you enjoy it and you learn it. Please make sure to give me a feedback through liking or making a comment. Have a good day.